Didn't butcher this, which I sometimes do. I believe we are live. Yes, okay. I can confirm we are in fact live. What's going on, everybody? Happy Wednesday. Hope everyone's having a fantastic week and you're getting after it. What we have going on here today is something very special. For the last several weeks, we've been highlighting the amazing and incredible stories of real cash physical therapy entrepreneurs who are doing the hard work in developing themselves, growing into their communities, and truly going from that physio to CEO role, because we want to inspire those of you who still kind of put the idea of owning your own practice up on this pedestal that always seems to be out of reach, or replacing your income that always seems to be just a few months away, because it's easy to think that it's easy for other people to do it. And it's easy to think that that's for other people and not for ourselves. And so the last couple of weeks have been a series to show you just how close people truly are, and to show you the real human side of building a business, not just showing the glamour, but talking about the hard stuff, the stuff that all of us are dealing with, the stuff that we don't really tell our spouses or our friends about because they don't get it. And quite frankly, most people don't care about that hard stuff. And so we like to talk about that, but then most importantly, share the knowledge, the stories, and the tips that are going to help you get unstuck, to help you believe in yourself more, give you the next piece of the puzzle. It's going to help you take that step forward. And so today we got Dr. C, our good friend that we've been working with for the last, 3-4 months, Collin?
Yeah, probably right in that range, 3 or 4.
3 to 4 months, and found out that he lives like down the street. He grew up in an area that Ty Smith, that many of you know in this program, also lived really close to. So we got a Scotty in the building, which is always really cool to get to work with. So what Collin has been able to do in a very short amount of time is nothing short of incredible. He's been able to not only get his practice up and running, find a location, master the sales process, and then also get ads up and running while being able to create this world-class patient experience basically out of nothing. He came into our world, didn't even have a location. In a very short amount of time, he's been able to hit that 5-figure month mark where he's creating massive impact within his patients and within his community, and it's only going up from there. So I wanted to bring him in here to share some of the backstory and some of the beliefs and the tactics that allowed him to be successful early on. And so if you're watching this live, first of all, thank you for being here. If you're brand new to the group, welcome. We do this every single week. If you have any questions for Collin or myself, make sure to drop them in the comments. We hold nothing back. We share everything we know and hide nothing. Our only request is that if you're watching this live, you comment live. If you're catching the replay, comment replay. We charge nothing to teach you everything that you ask us to teach you. And the only thing that we ask is that you engage, because that teaches the algorithm to push us out to more people in this incredible community. So without further ado, Collin, thank you for being here, man.
Thanks for the intro. Appreciate it.
Yeah. Of course.
Yeah. Got to live up to it now, right? So
right.
Yeah.
You
Absolutely.
You never disappoint. When I knew when we met you at the live event, first of all, I mean, I gotta say, you're a really impressive person just to talk to. Every single person that I know from our team privately at one point or another has come up to me after talking with you and be like, Collin's really freaking smart. And like everyone that we work with is obviously like brilliant, but the way you articulate yourself and the way you carry yourself, you have this energy about you that's definitely pretty impressive right off the bat.
Oh, I appreciate it. Yeah, as a former shy kid who was afraid to say 6 words together, that's good to hear. So
I think that's going to be a good thing for us to dig into, because I think there's a lot of shy folks that are in here who are not only afraid to take that step out of their comfort zone, but quite honestly are probably afraid of being good outside their comfort zone. I think that's a whole nother thing. So before we get into the backstory and the tactics, why don't you tell everyone about yourself?
Yeah, absolutely. So my name's Collin Christensen. I got to redact your story a little bit. I'm actually from Illinois. I'm a fib by nature, but I did move up here for school. My wife's the one who is from like the Pewaukee area. So I reformed, I guess you could say. So now I'm a Scotty. But yeah, I went to school up here, not too far from you guys, over at Carroll University for graduate school. Yeah, I guess to dive into a little bit of that, what I mentioned earlier, I'm an introvert by nature, I guess I would say. So that was always like, I think, a barrier initially, or at least it's perceived to be one. I think that there's certain strengths that come with that, as far as just how you interact and interface with people. And so I think it's worked in my favor once at least I kind of got over that story that I was telling myself that would maybe be a reason I wouldn't succeed, was because I'm just too introverted by nature, essentially. And just reframing that to be more that it's just I interact slightly differently than maybe what would be portrayed as like extrovertedness, but that's not necessarily a bad thing either.
Can I layer into that real quick? Like,
what's that?
I want to layer into that real quick, just because I think it's a fascinating contrast that not too long ago you were this, very introverted person, and you still can be, and we'll go into that in a second. But you went from feeling like being introverted is going to prevent you from being successful to a few months later. Now, I'm not sure if Ty was exaggerating. He usually doesn't do that, but do you really have 100% close rate on evals to packages off of those ads?
For everybody who's come in the clinic, I do have 100% close rate. Yes.
That is absolutely incredible. And now we're going to talk about numbers later to figure out, like, is there
sample size of 10. So it's a limited sample size for now for the 2 months, but so the N is important, as us PTs know, but
10 for 10,
10 for 10.
That's incredible. So I want to talk about that transition, because you went from this place of just fearfulness that your introvertedness will prevent you from being successful, to absolutely crushing it on the sales end, which I think is a really important contrast that I want to dig into with you here today. So didn't mean to cut you off from your story, but so
no,
you obviously had this fear. How did you overcome that fear? What got you to decide that you're going to start your own practice in the first place?
Yeah, so it's been a long time coming. I mean, I actually entered PT school and even undergrad with the intention of going into private practice and even cash pay private practice. I mean, I followed all the podcasts and, books that you could imagine in the space for all the influencers that have been in this space for a while. I always grew up like quieter, I would say. I was always confident, I guess, in like my academics, and but just always, like, if I was in a room of people, I just didn't feel super like comfortable, I guess. Like I preferred the intimate, like one-on-one conversation, like, let's please skip the small talk, let's just go into the the details of getting to know somebody. And so, but like knowing the field that I wanted to go into, I mean, like most PTs, you're motivated by wanting to help people. And as I was entering undergrad, I kind of was realizing, like, look, I've been like kind of quiet and reserved all this way up until, from high school. And I'm like, how do I like actually like get out of that shell? Yeah. It's been a gradual process. I mean, I for one, I accepted a job offer as an undergrad student, giving tours of the campus as like an admissions officer. And like I had to like cold call parents and things like people that showed questions about that, which was terrifying. I still don't know how I did it. But like it just kind of was one of those things where I was like, look, if I'm going to be a PT someday, I better get pretty damn comfortable talking to people. So I didn't think about it too much and just did what I was told to do. And eventually it kind of, I found my groove with it. And became more confident with that. Then throughout grad school, I did personal training for a while. I always liked fitness and things like that. So that was also a similar, position as a PT. Like you're spending time with people and kind of speaking to their goals and desires and their motivations, which I think played off of that kind of tendency that we introverts have to, like, we don't necessarily resonate well with small talk, but we just like to get down to the nitty gritty. Like we get energy usually from like deeper conversations with people. And I mean, that's like a hallmark of motivational interviewing, is like get, 5-6 questions deep down to the why. And so that's where I would rather be anyways. And so that just kind of translated, I guess, more naturally. And I think that's probably how my sales process goes, is to me, it doesn't feel very salesy, but I don't think it necessarily should either. It just kind of feels very conversational, like you're just consulting with somebody essentially. So it's been a gradual process. I mean, I've built confidence, and oddly enough, like I'm not, although I'm more reserved, like I'm not necessarily afraid of like public speaking when it comes to presenting or things like that. So like in an academic setting, I'm fine. Like I teach at local universities and go up and lecture and do things at conferences. But it was just more so a case of like that little voice in the back of your head is always kind of going off about like, well, remember, like you're the shy kid. Like, what if people just don't like you? Like what if you can't connect with people? But I think that that's just a game of constantly providing evidence through your actions that that's not a story that you need to tell yourself.
Right. And I think that's a fascinating subject that we haven't really talked about, like how I do sometimes think the labels introverted and extroverted work against us. And they're almost like shields to hide behind sometimes, because to me, and I mean, I'm no expert in this, but to me, extroverted and introverted isn't about your social skills, but about where you get your energy from. And I think most people who are introverted, I'm an introverted extrovert. I do not get my energy from people at all. But I think you and many other introverted people are cursed with a high intellect and short patience for non-meaningful communication. I think it's not so much that people are afraid of small talk as they are afraid of getting sucked into a conversation they don't care about.
Yep.
Would you agree?
I think so. Yeah. I mean, I think it's like anything else where if you just paint it as a false dichotomy where introvert or extrovert, and it's like, does anybody really exist as A or B? It's same thing, type A or type B personality. I'm like, I don't know, I'm type A over here, but if it comes down to this, I'd rather be type B over here. Like, I think there, like you said, there's limit to the values that, or to like the labels that we sometimes attach to ourselves. And I think that's part of the process of kind of like personal growth too, is getting comfortable moving outside of those buckets that we sometimes put ourselves in.
I think that's a good perspective that we'll circle back on later on when we're talking more about your sales process and how exactly you're doing things. That the perspective you should be thinking about your sales conversations isn't small talk. It's meaningful conversations, meaningful, interesting conversations that you should go into with a high degree of curiosity rather than pressure to sell anything. I think that's interesting. So let's circle back on that. So before you actually started your practice, before you got intertwined with the clinical marketer family, what did you expect starting your practice to kind of look like? Or did you have any fears, or were there things that you were really just not looking forward to sorting out? Obviously, you're not just highly educated, but you research a lot. You've read a lot. How clear was the path laid out in front of you before you connected with us?
Yeah, I would say, I mean, it's somewhat murky. As far as like I said, I had spent a long time just kind of ruminating on this whole process. I mean, I'm someone that is certainly guilty of sometimes overanalyzing. I don't know how many hours of podcasts and books I've consumed, with that sense of like feeling like I'm moving towards my goal, but really you're just sitting there treading water. And so as far as the path forward, I mean, I had a few like scenarios where I had previously invested in like a different coaching program, and it was really like nothing against the coaching program. It was a well laid out program, but it was everything I'd already heard on the podcast multiple times over. And there was just some limitations in some of the action items. Essentially, like it was kind of the usual, like, yo, you gotta, go to local gyms and hustle and, put on workshops that people don't sign up for afterwards. And, just do that for 6 months and you'll kind of gain traction as you go, essentially, which I wasn't opposed to doing. I've certainly done some of that. But it's slow and it's a grind, and and somewhat in this area of like Milwaukee, where there's tons of PT schools and other cash practices, like it just feels oversaturated. Like every gym I stepped into, like already knew 1 to 2 other PTs who had already come in and asked about workshops. And so I just always felt like I almost felt like I was kind of like going somewhat against my nature. Like I felt like I was stepping on toes or asking before I could really give value in some ways. which always kind of like just rubs me the wrong way, I guess. It just didn't feel natural to me. And so as we connected with clinical marketer, it was at least, I would say the difference was just more in terms of there was actually like clear action items and steps. And there was things that it was like, we actually looked more deeply into like, here's systems, and not just like, let's not just vaguely talk about systems, but like, here's our systems, and like implement A, B, and C. And then once you get comfortable with those, like, this is how you can kind of create your own processes. So the guidelines were much stronger, and at least gave you more confidence to act in the early days too, by having some actual rails essentially to roll on.
Got it. So when it came to, jumping in with us, was it really the systems that was the deciding factor on it?
Yeah, I mean, it was the systems. It was the fact that like I knew that marketing was an important piece that I just had no idea how to do, was beyond just the grind of it. And I was like, I don't necessarily know if I need to consult anybody about how to host a workshop. Like I understand that piece. Like it's more so like, how do I actually like get more people aware of my services without just solely relying upon like my physical presence, essentially.
Yeah. So when I know, I mean, you even mentioned it yourself. Whenever people talk about systems, it's always extremely vague. Everyone says they need systems, but no one knows what the hell they are. So can you mention just like 1 to 2 systems that you've been able to implement while working with us that have really made an impact? And then we can choose just one of those and we'll go a little bit deeper on it.
Yeah. The biggest one I would say is probably just the email automations. So having pipelines, as they're kind of called. So patient or potential client opts into this question. You now have a drip campaign of 1, 2, 3 that kind of gives them a bit of just a nurturing sequence. And then you can feel free to customize that as much or as little as you like to start with. So that would be one system. And then just on the back end too, like some of the like tracking sheets, I guess, as well would be another one, where it's just like, here's like your daily steps, which just makes it much more clear cut and black and white. I think is in the early days, it was a lot of just the static of noise of like, what do I do next? Like, I know I have to do like 25 things, but like, where do I go? Like, these are all important. How do I decide what's important to do? And so having at least more of a guideline of like, before you worry about step 25, let's start with step 1 and then 2 and 3.
Speaking of like, when you talk about nurturing, we have a lot of different nurturing style campaigns depending on where patients are at in the pipeline. Is there any one particular one that you put together is like, that was the coolest one? I like that one.
Yeah, I mean, I would say I really like the like value sequence, as far as like, say someone opts into a shoulder inquiry. And maybe they're just a bit too hesitant early on to hop on a phone call with you. Because I totally understand that, like the same time too, like people, they might opt into something and then have that bit of regret afterwards. And like, oh God, this guy's going to text me like 3 days in a row. I don't want to say anything. And so it just gives them a way to like, you can still serve somebody by giving them some information and just, be like, look, I get it. Like, you're not ready right now. I'm here when you are ready. In the meantime, let's see if I can't just give you something to make your life a little bit better in the meantime. So that I like how that plays out.
Yeah, that's such a good one, because a lot of people think that Facebook ads generate low quality leads because people aren't answering. And yes, we only expect 40% of leads acquired to actually show up for an appointment. That does not mean the other 60% aren't good patients. It just means that they either A, don't know you, don't trust you. They want to see what else you got, see what you'll do to earn their trust. Or B, it's just not a good time in their life right now because they're busy. And C, they never realized that physical therapy was the solution to their problem because they weren't researching for it on Google. And so by having that nurturing sequence, I agree. It's one of the most powerful things that people should have. And if you're watching this right now and you have a means of building an email list, whether that is through workshops or ads, you absolutely should take the time to put together. I mean, how many emails do you have in your sequence? It's nothing. It's usually probably nothing crazy.
No, I think in the initial one, like it's 3 emails, and then the value sequence for like education is a series of like 4 or 5.
Yes. So basically, we're just following up with them for a week, and then we have them in a long-term, reactivation style thing. So but was any of it like super complicated? Did it take you like 2-3 weeks, 6 months to get any of that set up?
No, I mean, I think as long as you approach it in a stepwise fashion of I'm going to approach this module. What I want to get out of this module? And then before I can move on to module 2, like, did I implement something from this module? And I think if you follow that framework, like, it pretty cleanly lays the process out for you.
Yeah, beautiful. So just for those listening who are trying to take notes for this whole thing, and I hope you are, because there's going to be really good stuff to talk about in here. But for nurturing leads, what he said is for the first 3 days, we're following up with them, trying to get them on the phone so we can book them for an eval. If they don't answer the phone or aren't ready to schedule with you in those 3 days, we add them to a 5 to 7 day nurturing campaign where we're delivering value, we're sharing stories, we're overcoming false beliefs. And then at the end of that, if they're still not ready to get on a call, we add them into a long-term reactivation text and email campaign. They'll follow up with them every 30 to 60 days. And it's a really effective and really simple system. So not surprised it's your favorite one. That is a really cool one that takes a lot of make sure people don't slip through the cracks at least.
Absolutely.
So for sales, I know we have Brady and a few people on here saying 100% conversions on those evals is absolutely insane. Now, obviously, it's only 10 for 10. That's something to be celebrated, but is it statistically relevant? Who knows? We'll find out. But tell us about your sales process. Before working with us, did you have any sales experience? Tell us about that.
Limited. I mean, I would say my sales experience was probably to the extent of like when I was doing personal training, pretty much everybody I would get in the door had already opted into an interest in personal training.
Yeah.
And I think in some ways selling personal training is easier because the expectation is already you're going to pay cash for it. Like there's no taboo about like nobody's walking on the door, like knocking your door down. They're like, how do you like Medicare? Take my Medicare for training sessions. The expectation is you're going to be paying out of pocket and that it's a luxury and almost like a kind of a like status thing to do so. Like, okay, I can afford like having a trainer. Like this is a cool thing. Like I should be excited about paying this. And I think that it's sometimes a bit more resistance to that in the healthcare space, of course, because people want to use their insurance. It makes sense. But I would say as far as what's that?
No, you go ahead.
I would say as far as the sales process goes, it really doesn't feel that much different than to what I did in the clinic anyways. So from our background on me, I graduated PT school in 2020 and dove right away into an orthopedic residency. And if nothing else, the residency made me very good at a few things. It made me very efficient and confident with my clinical skills. It made me very efficient with communicating that to patients. Like, here's what I found. Here's what this means. Like, here's how long I expect this to take. I would recommend A, B, and C. And if A, B, and C doesn't work, we go to plan D. And so you always have a path forward of like describing that. And, just being able to kind of like gauge the room as far as like where people are ready to commit. Like, is this someone who I want to give 10 exercises to, or is this person ready for one thing today? And so I think that at least translated into like this process, because now it's just when it comes to talking about price or plan of care, like package, it's really just part of my prognosis. Like, this is going to take 8 weeks to get better. This is what 8 weeks costs. And it doesn't feel that foreign. Essentially, it's just a different conversation.
Do you feel like when you are having these conversations with folks, are you trying to feel out for what they're ready to invest in? Are you looking for that? Or are you truly prescribing exactly like what you think, what they need to get what they want? So I know some people like judge a little bit where they're like, this person couldn't do a 10-pack. They're giving off some weird vibes. I'm just going to put them on like, a follow visit or sell them a 4-pack, Of
course. Yeah. I mean, I think it's a dance of both. I think that people what you need to give people is what they need at the moment. And so to do something other than that, in some ways, isn't fully understanding where they're coming from. That being said, I don't shy away from telling somebody if this is a condition that is going to take a while and significant investment. I just try to couch that in a way that doesn't make them feel hopeless, essentially, or like just doesn't meet them where they're at. So, I mean, I guess to give an example of that, because I have had one case where a gentleman came in with a severe lumbar injury, and he was demonstrating signs of spinal cord compression. And during the exam, I essentially told him, and I make this very clear with all the patients, that if I don't think I'm the right answer to this problem right now, I'm not going to hold you to any, like, I'm not going to hold on to you and keep trailing you along. And so I actually referred this patient out to a local orthopedic and neurosurgery practice with my exam findings, and kind of expedited the process for him, faxed over the documents and whatnot, and kind of explained to him the pathway. And he actually came back once he had his procedure done because of that. And for me, this was actually like one of the first patients that walked in my door. And like, it's sad to say, but you had that thought in the back of your head, like, maybe I can get this guy better. Like, if I kind of need this guy right now. But it wasn't right for him. So I think if you lead from a place where you're giving the patient the proper recommendation, they're going to see that in your body language.
Yeah, I think that is the part of selling that is, one, a relief to most PTs when they realize like that's really all selling is. But it's something that takes them so long to realize that you're not trying to like take off your clinician hat and try to convince someone that they need your services. As an expert, you're just telling them what you know they need to get better, and coming from a place that's open and honest, where you are, willing to push them somewhere else if they're not a good fit. And I guarantee that's why your conversion rate is where it is, because people can feel that authenticity in your voice when you do say you're the right fit, because you're actually telling people who aren't the right fit to go elsewhere. I think that's brilliant. Is that something that that just came naturally to you, or is that something that you learned through practice?
Yeah, I mean, I think part of it's learned through practice in terms of identifying when they're not an appropriate fit. But like the desire to do right by people, I think is something that's intrinsic, of course. And I think that's not unique to me by any means. I think pretty much everybody in this space has that desire. I think it's sometimes we get caught in the trap of telling people what they want to hear and not what they need to hear. Yep. And those are two different things. And so I think that if you can tell people what they need to hear in the way that they need to hear it, that's kind of where the true power lies in terms of like getting someone the outcome that they need. And that's certainly a learning process as far as like giving someone a fair expectation of what they could expect, or if you need to rein someone's goals back a little bit and be like, that's something that you can achieve at some point. Will I tell you it's okay to do in 8 weeks? Maybe not. I'll do my darndest to get you there, but this is what I think you'd achieve in 8 weeks. Is that okay with you? And framing it in that way.
What would you say to the people who are pretty new to sales? They started a cash practice out of necessity, not because it was ever a goal or a dream. And they're afraid of telling somebody something that's going to push them away or make them decide to go, back somewhere with their insurance. Any advice for the people who are afraid to really tell them their truth and, be honest? Entirely, obviously there's no one lying, but like sometimes people are afraid to push back on people,
Yeah. No, I mean, I think just a simple example too is like, if you could play out both scenarios in your head, like down the road, like, or you put yourself in their shoes too, where it's like, if I truly had this scenario happening to me, would I want someone to tell me right away? And so that I knew that I could make that correction, even if it's like kind of unpleasant to hear in the moment, or would I prefer them to kind of like spare my feelings? But then, a few months down the road, I'm still, not where I want to be. And like, I feel like you kind of skirted around the issue because it was uncomfortable for you to say it. Like, that's more of a disservice to the patient than it is like anything that you're going to feel. And it's as simple as like the joke about like, if you have something in your teeth or your fly is down, like, and someone's afraid to say like, hey dude, check out your zipper. Like, do you let them walk around all day because you kind of feel weird about saying that? Like, it's a silly example, but how much more so for someone's health and pain and their goals. Like, so yeah, that's how I would look at it.
Yeah, I think that reminded me of something that Ben said at our event. I forget which keynote it was about, but he was basically saying it was like, you can't be afraid to sell and say the things that are, have those hard conversations, because if you don't have them, someone else with less clear and honest intentions is going to. And so if they don't come on with you, there's someone who's going to recommend a surgery that they don't need, or, hook them into multiple like chiro visits a week indefinitely, or, something worse. And so, yeah, I think that's some sage advice. So we typically, I try to keep these short and sweet, and I could talk to you literally all day because there's so many different directions we could go to, and you're just the fun guy to talk to. But let's say you have 10 minutes or less to teach someone that you really care about and you want to see them succeed in their practice. You got 10 minutes to help them improve their sales. How would you do it?
Yeah, I would say it's a super cliche thing to say, but it's like partially like, you have to kind of be true to like how you communicate and talk with people. Like, I don't think you need to put on an air with people. Yeah. And sometimes we get a bit rigid like that in the PT world too, because you're told that you have to like play the clinician or the doctoring role. But to like go off of the things that we've talked about so far, I would say, for one, like, don't shy around like the facts of the case in certain scenarios. A lot of times what I do, even like in the consultation call with people, is that like I just kind of address the elephant in the room, like right out of the gates. And I said like, oh, I saw that you clicked on the voucher here. I mean, obviously you're probably curious about this thing. And like, you probably want to know, like, is this going to cost an arm and a leg? And you probably want to know, like, do I really have a solution for you? Or am I just another guy who's trying to like get you to come in the clinic to collect your credit card? And people usually laugh, like kind of shocked that you would say something like that. Yeah. And like, but you'll just say like, I get you, because like people have been around the block. And I would say the majority of people I see are people who've already seen 2 or 3 or 4 other clinicians, and now you're knocking on my door because obviously you're not where you want to be. And that naturally kind of leads into the conversation of like, what about those things didn't address your needs? Like, why do you feel like you didn't get where you were? Like, do you feel like you were listened to in those scenarios, or do you feel like you were treated in a way that was just maybe like the clinician was comfortable doing X, Y, and Z, and so you got the same treatment as everybody else? And a lot of times they'll give you, more clear guidelines like that as well. And so like that partially takes the pressure off when you lead with something like that. And two, like, I think that it's easy to, I would say, like, another helpful thing is to kind of get out of your head as far as like what the outcome of the conversation is going to be. That's neither here nor there. Like, the best you can try to be is like kind of be present in that moment with the person that you're with, and just kind of talk them through everything that you would want to hear in their shoes. That's something I always heard through when I was doing my residency training, was he basically said patients want to know 2 things when they come in to see you. They want to know, is this something that can get better? And is this something that you can help me get better? Or do I need to go somewhere else? Everything else is just, like a little bit extra, little spice on top. And so like, don't spend your time on that too much more than spend your time on the questions people actually want to get answered. And that'll just build more trust in what you have to say with people. So part of like that sales process for me is, as far as I think what's led to the, successes, the 10 successes I've had so far with that, is I try to just take all that pressure off of the patients and try to like do kind of like the certainty anchoring that we've talked about in the past in some of the sales calls, is essentially kind of play it out for people. It's like, from what you've told me, this could be A, B, or C. depending on if it's A, B, or C, like A, B might do well with this thing, C might do well with this. If it's not in those camps, I'm going to connect you somewhere else where it's a better fit. I try to take the pressure off of like the money question with people as well too, by just prefacing with them that my first and only concern is that they leave that call and that visit that day with a much better idea of what they have going on and what they can do to help themselves. And so I tell people too, it's like, I don't even care if you like put a credit card down on the first day. Essentially, I tell them like, you saw that as a price associated with the voucher. That's mostly to just get people that are willing to invest in their health. To me, like if you come in the clinic and we go through an assessment and it doesn't seem like a good fit, I'm not going to charge you anything. And then second of all, I'm going to make sure I do everything in my power to connect you with someone who can get you a fix. And, we do the 3-visit guarantee essentially as well, where it's like, if you do decide to come in with us, like you could do 3 visits. And if you're not getting significant progress, no harm, no foul. I wasn't the right answer and we'll give you your money back. So worst case scenario, what happens? You spend 4 hours with me one-on-one, answering your questions, listening to your concerns with a clinician who's got lots of experience in this area. So at the very least, you're a little bit less uncertain and maybe you get referred somewhere else. And best case scenario, you're 4 visits in and you're already pain free and you're well on your way back to your goals. So is there anything to lose?
I said this in the comments and I decided like early on, I was just going to shut up because you're just saying so much good stuff. I hope you all watching this are taking good notes because he's talking like, he's going through it quick. Rewatch this because there's so much gold in not just the words that he chose to say, but in the way he's positioning the offer to them. And so I think the guarantee that you're offering is brilliant, that if you show up and I can't help you, then I'm not going to charge you anything. I think that's really, really good. The question that I know people are asking themselves is how are you making sure that people aren't just taking advantage of you?
Yeah. So, I mean, all transactions are just based off of trust. And I would say like, if you can't trust me and then I can't trust you, then like it doesn't matter if I treat you or not. Essentially, like we're not going to get to point A to B. And so in that kind of scenario, like I think people genuinely like operate off of reciprocity.
Yes.
And so if you provide people with good value and you show them that you genuinely care about them and that you're not doing it just for a paycheck, that you're doing it because you genuinely want them to get better, that's a stone cold person who's going to run you over the coals. And if that's the case, they were going to do something terrible to you anyways. And it's better not to lose any sleep over it because that's just a person who's miserable anyways. Haven't had it encountered so far. If I do, it'll be a learning experience as far as what steps I can do to mitigate that. But for now, I'm just going to kind of operate off the model of trust and taking care of people.
I think it's the right way to do it. There's enough good things that don't happen in this world because of what ifs. So I think that's wise. Before we move on to the last question here, is there anything that, because ideally, you're filtering those people out on the triage call as well when you have that phone call. Are there any red flags that you look for in someone before you let them in? This is super relevant because I was talking to someone today who was allowing anyone to get on their schedule and they're wondering why they weren't converting. And it's like, well, you should be figuring some of these things out before they show up. So how do you kind of handle that?
Yeah. So, I mean, I do pretty much most of my subjective history over the phone with people, and I will fill out part of their evaluation form while I'm talking with them so that when they do get the eval accelerator form, like it's already like 25% done, which I think also helps their process. But I would say as far as red flags go, I think if the person is super incessant upon they only care about what the cost associated with it is, I understand questions about it. It's a fair question. But if they like can't get off the subject to even talk to you about what they have going on, it's better for them to be in a situation where they don't have to worry about the costs at all. And in those scenarios, I'll encourage them to seek their care through their insurance. I would say if they don't have a real, like, if they don't really have a noticeable enough like injury or history, like if you're asking them questions on the phone and they have a very hard time even kind of describing if they actually have a problem or not. Because some people, I think I've had a few hop on the phone where they're just kind of more so curious for like fitness purposes.
Yeah.
And I don't immediately turn those scenarios away, but like you'll see on some of the evaluation accelerator form, part of the question is like, what's kind of the why behind you're doing this? And if you're not in a place where you truly need like some assistance and mentorship, and you just maybe you're curious about like how you'd be a little bit healthier, this might not be the best pathway for you. You might do better with a service that's maybe a little bit less specialized, a service that's a little bit less focused on like the rehab side of things, and maybe I should connect you with a local gym or a personal trainer instead. So I'd say those are probably the big two.
Or we got to get you a medical fitness program launched.
Yeah.
Get them in there for that. Anyway, you've dropped, and I know you could drop way more on this, but if I was your distant cousin trying to start a practice and I only had 10 minutes to learn your sales process, you dropped some absolute gold on here that I know people are going to be very, very thankful that you dropped. So if you are watching this, if you're on here live or just catching the replay, please thank Collin for taking the time to do this. He's got a wife, he's got patience, he's got a life and things to do, but instead he's here sharing his information and knowledge and brain with all of you. So make sure to give him some love and appreciation. Collin, thank you so much for being here. If you have any advice for someone who's just starting out, who's on the fence about joining the One of Clinical Marketers programs, what kind of advice would you say or give?
Yeah, I would say you have to kind of lead by your desire to help other people achieve their goals. And if you're at a point where you truly know that like establishing a practice and cultivating a culture of doing that is the best way for you to serve those people, then ultimately like it's your responsibility to do so. And even though it's scary to make that jump, you kind of have to trust the process that like that if it's meant to succeed, it's going to succeed. So as long as you take those steps, and working with a group like Clinical Marketer takes so much of that guesswork out of the equation for you. Like it's okay to not be a sales or marketing guru. You can play to your strengths and lean upon the strengths of others and learn from those, and do what you do best and let that kind of shine, and the rest of it will kind of work its way out.
I love that. I love that. It's really, really good advice. Well, Collin, thank you. We're used up all the time that I'm willing to take from you. Thank you so much for being here. Folks, if there's any questions you have for Collin or myself, or want clarity on anything that we discussed here today, feel free to drop them in the comments. I'll hang out, make sure all of those get answered. But everyone have a fantastic rest of your evening. And as always, if there's anything that we can do to better serve you and help you advance your career, your business, or just help you feel better in your own skin as an entrepreneur, let us know what those things are so we can get you the content and the material and the resources you need to do so. Everyone have a fantastic rest of your night. We'll see you next time.